on drugs is a global phenomenon. Of the 11 million people in prison worldwide, 20% of them are behind bars for drug offenses, 83% of them for personal possession. In at least 33 countries, drug-related offenses can mean the death penalty. Yet, people worldwide are still using drugs at skyrocketing rates. The drug trade is a thriving $500 billion industry, and a recent UK study of 14 countries concluded that there was no relationship between a country's toughness of enforcement against drug possession and levels of drug use in that country. The war on drugs is obviously a global failure.
Okay, I've been using heavy, hardcore drug for almost 16 years. I started with a decision. I want to commit suicide, but I don't have the courage to do it quickly and for once. So I chose to do it slowly using drugs. I've been arrested several times for using, but each time I never took a decision to quit. So the first thing I do when I get out is to go back. It's all private rehab centers. There's no public one or national one. So, and there's a few of them which is affordable, but most of them it's so expensive. For the high number of the addict people here in Lebanon, it's not enough. It's one of the worst prisons in the world. The capacity of prisoners are so high, even at small, very, very tiny room. Sometimes you find 7 or 9. I'm talking about like 2 square meters. They have nothing to do with the prisoner. Sitting there, watching TV, playing cards, fight each other. That's it.
And are there drugs inside the prison as well?
Everything is just in the prison.
What if Ahmad lived in Portugal? While living on the street, even before using drugs, he would have been targeted as an at-risk group with messaging about getting help, maybe on a billboard advertising services and care. Or one of the harm reduction NGOs funded by the state might have found him and gotten him to a methadone clinic. But let's say he used heroin anyway and was caught using it by the police. He wouldn't be detained. His information would be taken and he'd be given a ticket to appear before one of the country's 18 commissions for the dissuasion of drug abuse. He would go to the commission, which consists of 3 people nominated by the Ministries of Health and Justice: a legal expert, a health professional, and a social worker. There, His reasons for using drugs, his history, his substance abuse issues, family background, work status, all of these things would be discussed. Members might attempt to make him aware of the harmfulness of drug use, including the consequences of further offenses. They'd explain, recommend, and refer him to various treatment options. From there, he might get appointed to a social worker or have to regularly report to the commission or go to group therapy. Or he might be treated in medical centers specializing in drug-related care, like Taiwan in Lisbon, which provides consultation, treatment, psychotherapy, and methadone via 3 teams of psychiatrists, psychologists, and social workers. Meanwhile, the commission would report his case in a central register of drug users, which tracks primary reasons for drug use in the country, drugs currently in use, in what proportions, and in what region. This all makes it possible for the government to diagnose the market situation of drugs and users and to adapt prevention methods.
应该也是跟我先生认识才开始，因为其实这种东西我也不知道它是什么，然后我认识我先生他有这种东西，我才知道说有毒品存在。所以爱情或使人盲目，我觉得这个是可能印证的。对，然后我先生他们的家庭那我公公。他就是比较爱喝酒，那又会跟朋友小玩，他有让我70，那我一开始去吸食这种东西是好奇，可是碰触以后，我觉得其实好像这个不是我想的。就是我回来算5年多了，那我先生让我1年，他回来4年，可是他前阵子又因为毒品又进去里面的戒又回来，他一直觉得说知道用这种东西不好，可是他说他又控制不住。
What if Anonymous and her husband lived in the Czech Republic, where, in the early post-Soviet period, possession of, quote, greater than small amounts of drugs was criminalized, but individual drug use was decriminalized? While there, they could have gone to their doctor, who could prescribe buprenorphine to treat opiate dependence, the only treatment modality associated with reducing overdose fatalities. Or they could have visited one of the country's contact centers, which provides needle exchange, counseling, HIV testing, crisis management, and other health and social services. Or Anonymous could have checked into one of the country's therapeutic communities, like the one in 𝘕𝘯𝘢𝘕, which allows women to live with their children in a setting that includes parental skills classes, work training, sports, and other leisure activities. And what if Anonymous lived in Switzerland? She could visit a heroin maintenance center, along with more than 70% of heroin users in Switzerland. She would get support and assistance from social workers. In Switzerland, between 1991 and 2004, drug-related deaths fell by more than 50%. There was a 90% reduction in property crime, and the same country that once led Western Europe in HIV prevalence had among the lowest rates in the region. It's all part of a philosophy called harm reduction, a public health approach to drug use that saves money and lives. For every $1 invested in drug treatment, there's an estimated $4 to $7 in social return. And of course, drug-related deaths and blood-borne viruses are prevented.
not only applicable to drugs, but to several other activities involving high risk. For example, it's also harm reduction when you drive a car and you fasten your seatbelt, or when you ride a bicycle and you wear a helmet. Similarly, you can provide people who use drugs with sterile needles and syringes to prevent bloodborne infections such as hepatitis C or HIV. This is called needle exchange. Or you can prescribe opioid medications such as methadone or even diacetylmorphine, which is the medical form of heroin, to heroin-dependent people to prevent them from buying dangerous drugs in the black market. This is called opiate substitution treatment, and it is not only effective in improving the health and well-being of patients, but also in reducing crime.
𝘎𝘭𝘰𝘣𝘢𝘏 record 𝘎𝘭𝘰𝘣𝘢𝘢𝘏𝑜, but because of wàhálà àmì kọ́tọ́ ntì ọmụchimi yẹ kọ́drẹ́mù 16 months náà ka ebi a ọmụ ayẹ hospital bi a detention center wíkọ́ a náà yẹ di ìkyẹ́ ònyìnbó bi náà yẹ di wíkọ́ a asana mẹ́firi ọ̀sẹ̀ phone kọ́ a mẹ́tìmá ẹ̀sùn repair wọ̀.
Aí o cara passou lá em casa e falou, pô, Julinho, chegou uma maconha nova lá no morro, pô, a maconha tá boa, vamos lá pegar. Pô, vambora que depois, mais tarde a gente vai lá pro show do James Brown, que a gente já fica com maconha pra gente ver o show. Eu falei, já é, vambora. Aí quando a gente chegou lá no morro, a boca de fumo tava fechada. Então a gente tava numa fila, esperando a boca abrir. Estamos na fila esperando. Isso já era umas 2 horas da tarde. De repente passa um moleque armado na boca, né, com a pistola pra cima, fala: sujou, sujou, os homens estão no morro. Aí o cara já deu um monte de tiro na nossa direção. Aí eu tomei o primeiro tiro no braço, tomei esse tiro aqui, ó. A bala subiu, bateu nesse osso aqui, desceu para do lado do coração, como você pode ver, ó. Tiveram que abrir para tirar a bala ficou esse aqui no meu coração. Fala pra ela. Aí passaram-se os dias, eu fiquei preso no hospital, fiquei com mal algemado na cama 1 semana, depois eu fui para Políncia, aí 3 meses depois eu fui condenado. Fui condenado 7 anos no tráfico, eu fui prego nem com a banana, 5 anos na formação de quadrilha, que foram pegos 6 pessoas nessa operação. Fui condenado a 5 anos de formação de quadrilha, não conheci ninguém. E fui condenado a 6 meses por porte de arma, não fui pego nem com a Gillette. Fala isso pra ela. Olha, eu esperava ser condenado por causa do racismo institucional que a gente já vive. Eu sempre tive consciência desse racismo institucional que a gente vive. Eu imaginava que eu fosse ser condenado. Agora, pra minha surpresa, foi ter caído tanta cadeia, né? Eu achei que fosse ser pelo menos a metade, achei que fosse ser condenado em 6 anos, 5 anos. Claro, muito racista, o sistema prisional é muito racista e os carcereiros, a maioria dos carcereiros, assim como na polícia civil, são brancos. Então muitas vezes eu vi aqueles carcereiros torturavam, porque a gente sabia que torturava, que batia muito nos outros. A gente via como senhor de engenho, sacou? Eu via, às vezes eu me sentia num cativeiro, numa casa de engenho, sacou? Me sentia num pelourinho. Porque é muito racista mesmo. O cara chama os caras que são brancos então chama de crioulo, de macaco o tempo inteiro. Os carcereiros brancos chamam os pretos de crioulo, macaco e tal. Não dava para todo mundo dormir ao mesmo tempo, tinha que fazer plantão para dormir. Ficava um monte de gente em pé, esperando. Cada preso dormia na média de 2 horas por dia. Então o cara dormia 2 horas, chega a acordar o cara, olha, levanta que eu quero dormir. E era isso o dia inteiro, né? Porque era 60 e tal na cela. E como eu tava...
What if Tete and Julio lived in Uruguay, the first country to legalize marijuana in 2013? They could walk into a pharmacy and request marijuana, or join a cannabis club for special grades of cannabis, or grow up to 6 of their own plants. Evidence from Uruguay shows that after legalization, use of marijuana did not increase among adolescents, arrests fell dramatically, taxes derived from the market could be spent on things like education, and job opportunities were created.
I grew up, like my family, like they were pretty straight. Like, my mother's, like she worked hard all her life, you know, pretty much. I mean, she's still working today. And my stepfather, he was a hard worker. But it's just when I got to the age of about probably 15 or 16, and at that age I just wanted to go out and, you know, do my own things. And that's when I started seeing it. So, I was actually working at the time, and I used to come home and I'd have like some family members, like from my ex's side, they'd be sitting around smoking cones, or that's how it started. I was like, I'm going working hard. And then I'd come back, and then it just started breaking down slowly from there. Then it got worse. I started on the ice. I couldn't sleep for like 4 days. And I said, I need something to come down, and that's when old mate offered me. He said, oh, these are oxycodone. Something. I started on that, yeah. I was on the oxycodone, and I just went downhill from there. It's just like popping at first. I started popping, and he said, oh, you can inject it. And that's when I injected it. I never looked back from it. I said, I like that. I like that every day, pretty much. I try and get it every day. That's when I started. And then the money started running like low, and the way I could do it was to go out and rob people, or do whatever for it. It gets to the point where when you start taking off your family and that's when you know you sort of got a problem. You know? That's when you hit rock bottom.
Yeah.
But I did have family there, like trying to help me. But the drug was too powerful, pretty much. It just overtook everything. Ruled my life. Pretty much I'd wake up looking for it, and I would not do anything until I had one, like even sleep or anything. You get back out and you're doing the same thing pretty much. It's just a revolving door, like you're in, out, constantly. And, yeah. instead of building more prisons, I think they should build more rehabilitation centres, I suppose, and focus on training more people about, and maybe people that have been there themselves and stuff, try and get them into a role, like, so they can try and tell the younger fellas that are starting to do all this stuff, maybe, from experience, just to help them a bit, I suppose, maybe for Indigenous sides too, like, maybe focus on a bit of culture, like taking back to the old days, talk to elders and stuff like that.
So what if Elvid lived in Canada? Where did you grow up? What neighborhood?
Six Nations.
And can you describe for somebody who's not familiar with that?
That's a
what is that like?
Like Sioux Reserve, right? Growing up, there's a lot of drinking, a lot of partying, right? So like you get sucked in that lifestyle pretty early on. So it's, yeah.
It was all just drinking again, and getting in trouble, drinking and stuff like that with the police. But it eventually got higher and higher, where I actually went to jail. It's not clean in there. I'm a diabetic. They used to try to give me other people's meds. I can tell. And the nurse would get mad, use them, they're not gonna waste that medicine. So I had to refuse, and then every time I went to medical, she would give me the same one until I would use it, and I never used it.
Like if you're incarcerated, there's like hardly any programs or anything like that, right? Like you have to be out to get the programs. So it's like, it's supposed to be corrections, but there's not a correcting going on. I don't think it's right.
But there's no treatment in there. We're in jail. This is not it's not Renaissance or Holiday Inn, We make our own booze in there. People that are in there are very intelligent. When you think about it, it's like, then when I sit in there and we talk, I come out knowing more stuff, how to do crazy shit when I get out. They were like, do this, do that. I said, no, I don't want to do that. Why? You're already in jail. What are you gonna do? They can't do any more to you.
It's like a group of elders get together here, right? And they decide what your plan is, right? So if you need treatment or anything like that, they do that and make you do that instead of going to jail. Right?
They referred me over to ALS. I guess it's there in the building too. And she said, "Oh, you're native. Yeah. We're gonna get this diverted." I said, "What's diversion?" Well, you get all the charges dropped, but you have to go through all these programs first. Like grief and loss, I just put myself into that one because I have a lot of loss in my family. Loss of my son. Me and my wife divorced, my father. I mean, it's like just a lot of death in the family. I come here all the time. That's how I know about these programs and everything.
Like treatment and grief counseling, that kind of thing, right? So I had to make sure I was going to those, and I had to come back and show the paperwork that I was going to those things and all that kind of stuff, right? So it was very beneficial. A lot better than incarceration, right? At least I was out doing things that I need to do to work on myself, right? Like it helped me out a lot because it was a time in my life when things weren't going so good. So it was like, it really, really helped me. Really did.
LSD, he probado el éxtasis, la cocaína, la pasta base, los psicotrópicos, que son toda la familia de las pastillitas mágicas, e incluso plantas ancestrales, como ser el peyote. He tomado floripondio, que mi psicóloga me prohibió tomar cuando era chiquito y no le obedecí.
¿Te ofrecieron en algún momento un apoyo, un tratamiento, otras alternativas a la detención?
No, nadie no te ofrece. Hay una iglesia, los cristianos quieren ayudar, vienen las hermanitas, las católicas, les dan a veces desayuno, cualquier cosa, porque a veces están un ratito ahí escuchando, aunque sea. Pero en sí, el tratamiento no hay. Lamentablemente, yo dentro de la prisión, yo nunca he visto un tratamiento, porque simplemente uno no... Cuando le da ganas de salir, yo a lo mucho dejaba de consumir una semana o 3 días. Una semana o 3 días, no aguantaba más. En la afuera sí ya he aprendido, he conocido ahora con la organización Acción Andina, la doctora Gloria, estas personas que me están ayudando, de esa manera sí me han ayudado con psicólogos, psiquiatras, todo, y en mi punto de vista para mi persona, yo he mejorado bastante. Hay veces que sí puedo perder la cabeza, cualquier cosa, pero no reacciono, ya no soy violento, ya no. Hasta en mis sueños evito las peleas. Eso quiere decir que la psicología funciona.
But what if Mauricio had lived in Seattle, in the USA? He might have been approached not by police, but by a care navigator from the Law Enforcement Assisted Diversion Program, known as LEAD, a decade-old community-based diversion approach to drug use grounded in the idea that public health and human services needs, addiction, untreated mental illness, homelessness, extreme poverty, should not rely on the formal criminal justice system. LEAD's navigator could have helped Mauricio identify and address the underlying reasons for his drug use and signpost him to trauma-informed harm reduction services, perhaps an intensive care management program where he could receive a wide range of support, including transitional or permanent housing. Prosecutors and police officers would work closely with case managers to ensure that all contacts with Mauricio going forward, including any new criminal prosecutions for other offenses, are coordinated with his service plan, thus maximizing the opportunity for him to make dramatic change in his life. Ultimately, the global reality is that, as renowned American scholar Dr. Carl Hart reminds us, not all people who use drugs are addicted to them. 70% of US users, he says, do not meet the scientific criteria for addiction at all, and this includes even those indulging in heroin or meth. After all, we don't ban sex, cars, or guns, which all have the potential to cause death or harm. Instead, we rely on education and harm reduction tactics to promote safe use of these things. Isn't it time we did the same with illegal substances? Stop the war. Just be smart.